We'd like to welcome you to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, doctor of physical therapy and owner of an award-winning foundation physical therapy here in the Salt Lake Valley. Each episode, we dive into all things rehab prevention, overall health, bringing you expert insights from leaders across the healthcare fields. Please note, while we aim to provide with the best knowledge and advice, the opinions shared represent those of experts in the field and are not to be replaced with professional medical advice. So let's revolutionize healthcare and wellness together. All right, welcome to the podcast. We are so excited to have Dr. Jared Aida on the podcast today. We are talking about coming from dependence to empowerment. How do you take a patient in the community that's very dependent on the healthcare system and all these interventions to doing things on their own, being independent, empowered, feeling like they have control of their life, things like that. So we're going to dive into all things in that area. We've had Jared on the podcast before. He's an absolute legend in the Valley, and a PM&R doctor. If you don't know what a PM&R doctor is, it is a physical rehab and medicine. So we'll go into the specifics about what a PM&R doctor is and how they can help you. But I want to give just a little background on the topic first. So we live in the most advanced healthcare system today in the history of the world, right? Yet people are more confused. They're dependent on medication, dependent on medical intervention. They're more fearful than ever. And I don't want this to be a negative podcast. This is very positive, but somehow our system is very fragmented, right? Patients are being treated, but not really taught, not really empowered. We've built a system that rewards procedures more than understanding how this is going to work and how it's going to create freedom for people. And ultimately, the result is a population that outsources responsibilities of their own bodies, which is very, they're just saying, do what you want with my body, which is a huge problem in my eyes. And that's what this podcast is all about, is empowering people to take control out of their own lives. But what the future of healthcare isn't more treatment, but it's more education. It's more accountability. It's more ownership. And that's really what we're going to dive into today. So if you're looking for that, if you feel that you have been trapped in this medical system of dependency, you're outsourcing your body to other people, this is the podcast for you, where we're going to dive into all those things of how to go from that dependency to truly independence. So just to introduce Dr. Aida again, he's doing exactly that. He practices that every day. He is a board-trained physical medicine and rehab, fellowship-trained in sports medicine with expertise specifically in musculoskeletal medicine, diagnostic ultrasound, and exercise science, but specifically in lifestyle medicine. So just all-encompassing expert at full body health. And so grateful to have him here and share his wisdom. He's worked with everyone from weekend warriors to elite performers, including the Washington Wizards, NCAA programs. He's done a ton of endurance races and just professional sporting events as a whole. His mission is not just to treat the injury, but more to prevent it and to make sure we're enhancing function, improving performance, and elevating quality of life for anyone that he sees. So welcome to the podcast.
It's good to be here. It's good to be back.
Yeah, well, round two. We're so excited to dive into this topic with you. Tell me what really ignited this passion for you on the importance of education, empowerment, and accountability.
I think, and we can delve more into it, but I think the heart of it is that it was probably sometime late medical school. And with medicine, it's like the first 2 years traditionally you're in the classroom learning, and then the last 2 years you're kind of doing rotations, you're working in the hospitals and clinics and whatnot. And you just start to notice that in Western medicine, for all of its benefits and great things that it does, there are some deficiencies with the historical model. And if you just look, you go to the doctor, and it's maybe like a 10, 15-minute visit, and what do they give you? They give you medicines, They give you medicines for, you have high blood pressure, here's your high blood pressure pill. You have high cholesterol, here's your high cholesterol pill. You have...
It's more like a dispensary.
Yeah, it's like a dispensary, And so you start to notice that later And there's a time and a place, but it's like, okay, you're doing that, but then what are we doing to make it so that they're not over reliant on these medicines? And like the big thing that is just like so many times patients are just and consumers of healthcare in the United States, or at least, are passive utilizers of the healthcare system. Okay, it's like they're just having things done to them, like medicine given to them, injections done to them, procedures done to them, surgeries done to them. But then it's like, if they don't change what they're doing, their lifestyle, how they eat, their exercise, their stress, their emotional health and well-being, if we're not changing those things, then they're going to be reliant and dependent on those pills and those surgeries and those injections and those procedures for the rest of their life oftentimes. And it just started to kind of gnaw at me in medical school, and then you see it even more in residency. And it's just like, sometimes you just feel like you're spinning your wheels, you know?
Yeah.
And it's very, very frustrating, because it's like, are patients actually becoming healthy, or are they just kind of on this like maintenance program, this wheel of maintenance, and they're not actually becoming healthier, you know?
Yeah.
And it just became annoying. And so I just started to like, we're going to practice different, you know? We can, and granted, I prescribe a lot of medications, I do a lot of procedures and injections, and I love doing them, but it's always in concert with some kind of lifestyle intervention to be like, okay, how are we going to, in the long run, remove ourselves from these meds, from these injections, from these procedures, so that you don't need them, and ultimately, like, don't need me.
Yeah. And that's ultimately where all of us should be as healthcare providers. Is this is an intervention, or this is the piece that you may need now. But ultimately, we want you to be free.
Yeah.
If I work myself out of a job, that I did my job right.
100%.
Right? Because my goal is to get you to get back to your normal things on your own and not need me anymore. And how empowering is that for patients, right? Because it's a journey we're going to take you on of this mentorship. And that's what I really like to think about healthcare, is we're going to mentor you through how to get through this phase, whether it be pain or whether it be your limited ability to do something. We're going to mentor you through the steps. We're going to use some tools to help us along the way, whether they be exercises, whether they be injections or a procedure, to get you out of this phase. And then we're going to get you to empowerment. And then we're going to get you to discipline with certain things in your life so it doesn't come back. And then we're going to get you to independence so you don't even have to think about these things anymore. Yeah. Right?
That's the dream.
The ultimate vision, right?
That's the dream. Yeah. That's the goal.
And you know, I hope that's the goal for every healthcare provider. And sometimes we get lost along this journey of medicine, and we get trapped in the system and the insurance complexities and the limited factors. Right? How many times have you had a patient come to your clinic? You're like, I know I can help you. Yeah. And then you find out, shoot, I don't take your insurance. Mm-hmm. Oh, and then it just like ties your hands, right? There's so many things in healthcare that do that to us, and you kind of become a little jaded by it, and then you kind of get trapped in the system unless you have like this deep like passion where you're like, no, I will not line up for that. Or I loved what you said with medical school. Like, there were so many things that were wrong with it, and I didn't want to follow that same journey. I didn't want to be a dispensary where it's just like we're on some maintenance wheel. I want to create long-term change for these people. Yeah.
And like the sad thing too is that, I mean, we beat it to death, but it's just like, if you are familiar with the healthcare system does not financially compensate people for teaching patients or for necessarily making them feel better. It's like, and so, I mean, hopefully not, there's a very, very small percentage of healthcare professionals that do this, but it's like, monetarily, like, you'll do better if your patients keep coming back to you and you keep prescribing those meds and keep doing those procedures and keep doing those surgeries, but it's not the best thing for the patient. And so we're just caught between a rock and a hard place, but it starts here, and just educating healthcare professionals and then educating patients that there is a better way, and just becoming an active participant in your health and in your healthcare journey, whether it be, high blood pressure, heart disease, or like arthritis in your knee. It's like there's a better way, to kind of become a more active participant. And I think when that happens, like patients like feel more accountability, and they're not just okay with be like, here, take this pill or have this injection. And then they start asking more questions and just becoming an active participant in their health.
Break that down for us. What does, maybe let's talk about a patient that is not an active participant. Give us an example of maybe what not to do, as what you wouldn't recommend, and then give us an example of what a good active participant looks like.
Yeah. So the passive participant is, unfortunately, I feel like it's how medicine was done back with like my grandpa and great grandpa, where it's just like the doctor knows best, and whenever they say, I'm not going to question it all. And they basically like, hey, you got high blood pressure, do this, this, and this, and good luck, be on your merry way. And they're dependent on having their physical therapist, their physician, what have you, like tell them what to do, and they just blindly obey. Mm-hmm. Okay. And they're just along for the ride. Another example would be, just for us, where we work with orthopedics and spine and sports a lot, is, all right, like you've got this bad disc in your back, and like we could do an injection, we could do some meds, but it's going to take you doing physical therapy or this therapeutic home exercise program to be able to kind of get you there and keep you in a pain-free zone, and recover. But then they're like, I don't want that. I don't want it to work. I just want pills and injections to make me feel better. Just make me feel better. And so those patients are very difficult to work with because there is a fundamental conflicting of approaches. Like they may want me to just put on my pain management hat and just make the pain go away, but I'm not going to do anything to actively kind of help. And then other patients are like, okay, like I'll let you do this injection or this procedure, but then what are we going to do to make it so that like I can get better or prevent this in the future? And so the former versus the latter of those two patients is like, makes a huge difference. And the latter are just so much easier to work with for someone that practices like myself.
Yeah. Tell us the danger of someone coming in and just blindly trusting. Like what's the issue with that? What issues do you see?
Blindly trusting. I mean, in some ways, it's tough because I don't think it's as bad as like blindly trusting as it is what it can mean, which is that they're just along for the ride, which
You're
means that they are
outsourcing your body, right? It's like, well, this is my body, but you tell me what to do with it.
Yeah, exactly.
Right?
Exactly.
It's like you tell me all the steps because I'm just thinking about like there's so many procedures that you could go through, right? And I love the way you educate. You'll typically say multiple procedures, and then you'll say which one appeals the most to you. Mm-hmm. Which one are you drawn to the most? Your job is to educate, you're not to tell them. But these patients that are blindly just wanting you to tell them, it's like, tell me the best procedure for me. Well, I could tell you what, my good, better, and best options are, but I'm not going to make that choice for you.
Yeah.
Right?
Yeah. No, that's exactly, like just literally yesterday, I had a patient, I'm like, because everyone's different, some people want to be very aggressive. Some people want to be more conservative. Some people are terrified of needles. Some people are scared of medications. And so when someone comes, it's like, okay, like this is a more conservative approach. And I'll give them like 3 or 4 different options. And I'm like, all right. And I'll tell them the pros and cons. And it's like, let's make a decision together. Mm-hmm. But sometimes they're just like, just tell me what to do. And I'm like,
yeah. I had a patient the other day that kind of did the same thing, where it was like, well, you tell me what to do. And I gave multiple options, and then they kind of pushed again. Well, what would you consider the best option? Mm-hmm. And I said, well, based on what you're saying, dry needling would be a good treatment for this and typically responds well. But your fear of needles makes me hesitant. They're like, oh, no, I'm fine. Let's just do it. We put the needles in. I'm not even kidding you. Literally bent my needle. I put the needle in there, tensed up so much that literally it was almost bent in half because the muscle contracted as the needle was in, and I just aborted ship and pulled it out. And I showed him the needle. It was literally bent almost in half. And these are, keep in mind, little microfilament needles. But that causes a lot of pain when that muscle contracts with a needle through it, you know, and it didn't end up going well. And, you know, keep in mind, this patient has high level trust and we have a great relationship. But that would be one of those pieces where I'd say, sometimes you know your body best and you know where you want to start. Do you want to start more conservative? Do you want to get more aggressive? Right? Our goal is obviously to do no harm at all times, right? And we're going to give you the best information that we possibly can. But ultimately, you got to be in the driver's seat. We want you to be in the driver's seat at all times. We're not here to take over the wheel of your body. Yeah. We want you there.
Yeah. And I do think it's important to note at this time that there's a fine balance, because I know you've had them, but there's patients that are just so skeptical of everything and anything. And you got to like pull out the research and like just, it's just the other way where I'm like, man, like they don't want to do anything because they're skeptical of everything. And whether that's from having like negative experiences with the healthcare system or just their personality, but it's just a fine balance where at the end of the day, it's just a healthy therapeutic relationship where there's a partnership with the patients and you are helped to facilitate like their journey, like towards recovery or pain relief, whatever it may be. And so it's
You're
just
helping them facilitate their journey.
Yeah.
Right? Because it's their journey. Right? I don't want to create this journey for you. You know, like it's your journey. I'm here. You're hiring me to come help you along your journey. But ultimately, you get to decide.
That's the thing, man. It's their journey. And so, because if they push it onto you, just from my experience, like they're not having that stewardship and that accountability of their health. And the patients that have accountability for their health and they have that stewardship, they're like, well, shoot, if I don't do these exercises that Brad gave me, like, I'm not going to get better. And I'm going to have to keep going to see Aida for an injection. And I don't like Aida, you know, or, you
What's
know,
not
just,
to like? I mean, come on.
But it's just like, and so I just feel like they need to have that ownership and that accountability. And I feel like as patients understand their conditions, as they understand this is what's going to happen if you don't control your blood pressure. This is what's going to happen if you don't do the exercise Brad gave you. Like you are going to be reliant on the system instead of potentially breaking free and just like needing the healthcare system as needed instead of being entrenched in it. Because
I love what you said about that. And sorry to finish what you're saying first.
No, go for it.
I love what you said about like having accountability. You know, like they essentially are having skin in the game, right? There's a piece that they're taking on. I love the PT model because it requires them to come in frequently.
Yes.
So there's like this commitment level. There's an unconscious and conscious commitment of time, energy, and money. And research shows the more time, energy, and money you invest into something, the more likely you are to get better, right? So there's like this piece of physical therapy. This is just my opinion. I think there's some research to back this up, but I think when people commit to those three things, there's automatically a placebo effect that happens because they're investing into their health. And it's a big investment. They might be going multiple times a week, you know, where they have to take off work or they have to go in early or stay late, right? But there's this investment piece telling their unconscious mind that I'm serious about this and I'm committed to this. And then there's a second piece. If you got homework now, I want you to do these 3 exercises 3 times a day. It should take you less than 2 minutes, but these 3 exercises are going to make a meaningful difference in your life, right? And then you're coming back and there's this accountability piece of you reporting, right? And it's super important. I can see if people aren't doing those exercises, like, come on, man. You know, but it's not me bantering these people or you know, like making fun of them or just putting them in this category of like, oh, come on, do those exercises, right? It's like, okay, so tell me about the value it's creating for you. Do you see the value in these? Do you know why you're doing the exercises?
Yes.
Right?
Yes.
Because if you don't understand why you're doing the exercises, you're not going to do them, right? It's like, well, I don't see value in it, right? And that's where I feel like we make a big error in my profession is we don't teach the why behind it.
I could not agree more. As soon as you said the why, I got excited and I wanted to say stuff because that is exactly right, is that we're not telling them the why, you know? And I don't know, I am just super passionate about patient education because now we've talked about this whole how can we make it so that these patients become not passive consumers of the healthcare, but like active participants of their health and like have more accountability and stewardship over their health. And in my experience, like that's at least like half the battle is the why. Because if they understand like the plan, you know, the bird's eye view of like what we're doing, why we're doing it, then all of a sudden they're more likely to do it and they get more excited about being an active participant in their healthcare instead of just being like, give me the pill, give me the injection. Why? I don't know. The doc told me to.
Yeah.
And so, but that is like a huge, huge deficit I feel in healthcare in the United States is just like patients don't know why they're taking this or doing this or why the plan is this way, you know? You just see it all the time. And I feel like why that is, I mean, a lot of healthcare professionals, they don't have the time, you know? And so, I mean, I have 40 minutes for new patients and 20 minutes for follow-up because like a lot of that time is just spent educating patients on what their pathology is, like what's going on in your body, why they're experiencing what they're experiencing, and then why we're pursuing this path of course, and what the plan is, and why the plan is the way it is, and what the goals are, and what we're like the outcomes are going to be. And, you know, and it's just once they see that, so many things happen. I think one, relief. I think it's therapeutic, you know, in and of itself. Two, what we talked about is they just become a more active participant and they have more accountability because they're like, oh, I'm not just a passive bystander anymore. It's like, I know the plan, you know? It's just like if you're a player and there's a coach and the coach doesn't tell you the plan, and he's like, you just go do this. You're like, okay, but like once you understand the why, like you're more bought in.
Yeah, and it's essentially alignment, right? Like I love the coach analogy. Like you have a team of people and you're teaching them, here's the ultimate goal. This is what we're doing. Everyone has a part. You're going to do this part, you're going to do this part, right? But you create this alignment with the patient of here are the appropriate interventions that we could do. You know, why don't you figure out the best one for you, right? And then we get alignment. The patient chooses the treatment. And then we say, okay, based on that treatment, here is the plan. Here's why we're doing this plan to help you get back to X, Y, and Z in your life. But our goal is to get you off of this injection so you don't become reliant upon them or off this medication and ultimately create independence in the end.
Yeah.
Right? Is there anything you'd add to that?
No, I just feel like, because when you give them options and they choose it, all of a sudden it's their plan.
Yeah.
It's not just my plan or Brad's plan. It's their plan.
My doctor told me, you know, this is, you own it. And ownership is like I would say one of the biggest pieces. You got to understand why you're doing it, but then you got to own the plan. This is your plan. We're just here helping facilitate the journey. That is powerful.
Yeah.
Yeah, I like that a lot.
It's awesome. When it happens the way it should, I don't think it's coincidental those patients do the best.
What happens to people internally, whether it be psychologically, emotionally, physically, when they are the steward of their own plan? Give us your thoughts on that. Because I know you've seen dozens and hundreds of patients that have owned their own plan.
Well, there's just like little signs you see. Like one, they're more bought into whatever the plan is that we jointly decide to do.
Yep.
So there's better follow-up from the patient in terms of whatever the plan is. Okay. Two is I think there's more excitement because they actually know what's going on with their body. They know what the plan is, and they know if we do the plan as designed, then we're going to have this desired outcome. And then three, the third thing is that they begin to do things outside of your plan that you haven't discussed. They're like, oh, I was looking into this, or oh, I got online and I was reading about this, or oh, and so they're starting to do more outside of what we talked about because they're excited and they want to get better. And so they just start to kind of become more active. They go out of their way to do stuff, or they'll give you more information, or they'll come back with more questions. They're like, I've got questions. And I'm like, fantastic, let's go over them.
Yeah, and essentially you're kind of modeling this perfect patient, right? You're like, I want people to come into the clinic with their own questions. I want them to be researching their own things, right? The old model was not that way. It was like, all right, we got time for two things, right? But now it's like, we want you to be curious. We want you to bring in what you have learned. We want you to be excited about your journey. You know, we want to be invested in it where you're reading and understanding more, and we can help essentially create bridges.
Absolutely. I mean, I have like a lot of like med students and residents that kind of rotate with me as well. And something, I don't know when I started doing it, maybe like 4 or 5 years ago, but I always ask like, what questions do you have, to like the med school students, to the residents, and to my patients? After I finish, go over the plan, I'm like, what questions do you have? Because one, it's like, if you frame it that way, instead of saying, do you have any questions?
Yeah, it makes a big difference.
It makes a big difference because now
this is how you know a true educator from a novice one, by the way. If you're hearing what Jared's saying right now, Dr. Aida, that is the difference between a high-level educator and a novice one. When you can ask that question. Yeah. Say it again.
What questions do you have?
Not,
do you have any questions?
There's a big difference.
It's a big difference.
What it creates is an open channel.
Yeah.
Rather than saying like, no, like, how many times have you been in class and a professor ends the lecture with that question? Any questions?
Yeah.
That's essentially shutting the door. But when you say, what questions do you have?
Because
that's opening it up.
You're opening it up, and there's an assumption that, oh, like I just gave you a lot of information. You're probably going to have some questions. What are they? And it kind of gives a subliminal kind of non-spoken cue that, oh, I should have questions. Because not always, okay? But if you have questions, that means that what? Like, you're thinking about things. Like, you're thinking about the things that I talked to you about. You're critically thinking about the information that has been transferred between us. And you are critically thinking, you're analyzing, and you're coming up with questions. And so, not always, but if I say, what questions do you have? And they're like, sometimes I'm like, well, shoot, were they actually like
Did
processing?
They process what I just said?
And were they critically thinking about what I said? And it's not always true, you know, but oftentimes it's because they're not thinking. And so it just, when I ask that question, there's a few things. It's like, one, like we said, it's a nonverbal cue, a little message that, oh, I should be having questions, because he says, what questions do you have? But also it's like, it's a kind of a gauge for me is like, how critically thinking, because if they don't have questions, I'm like, okay, we might have to work with this a little bit, because I don't know how much they're actually absorbing of what we just talked and kind of like discussed.
Yeah. Tell me, I love all those thoughts. Let's kind of shift a little bit. What tools do you use to take people from, you're explaining the why, you're talking about the procedure, right? How do you take them from dependency to independence? And I'm thinking like, tools like, how do you help them change habits? How do you help them have a reflection, or maybe journaling, or, develop consistency or discipline? Like, tell me that's a lot to unpack, but tell me like your go-tos for tools to help people from dependency to independence.
I think one of the first things that comes to mind is, just starting on the flip side, is follow-up. Okay.
Critical. Yeah.
You have to hold them accountable. You can't, I give my patients homework all the time. I'm like, hey, this is what's going on in your body. And I will give them like a 5-7 minute spiel about the pathophysiology and why it manifests the way and whatnot. But then sometimes I'll be like, I want you to go home and I want you to research this for 15 minutes and I want you to come back and tell me what you learned. Okay. And I will put that in my note and I'll be like, they're going to teach me what they learned about X,
Teach
Y,
back
and Z.
method, man. It's the best. Because then you help understand how they're interpreting it.
Exactly.
Because I'm seeing it through a certain lens as a provider, but you're seeing it through a certain lens as a patient. And how I want you to teach me to help me understand through your lens.
Yeah. And then you also understand the holes in their learning. And then you can supplement them with more education.
Yeah.
And so, but if you give someone, like sleep hygiene, I always give like sleep hygiene. I'm like, okay, I've given you a little bit, but this is a huge world. I want you to go and I want you to research 30 minutes at least on sleep hygiene on the internet and give them work. But then if they come back a couple weeks later and you don't follow up on it, maybe they didn't, maybe they did, you know?
Yeah.
But it's like you not following up on it is giving like nonverbal cues that this was not that important to me and I didn't care that much when I gave you the homework. And so that's going to be like, well, he doesn't really care if I do it or don't do it because he didn't ask anyway.
So ultimately, when we talk about health care, like it's improving people's health, not sickness, right? We're not focusing on the sickness, we're focusing on the health. But also there's this care portion that, maybe we've lost over the years. I don't know. I think some providers are really good at the care portion, but the care is the follow-up. It's, I'm here to help you.
Yeah.
And I care enough to write notes for myself, or even better yet, remember. I remembered I gave you that assignment, right? I remember that I need to do that follow-up with you. I remember that there's this accountability piece of you have an assignment. I want you to report back.
Yeah. And then if you don't, it's like, you're not going to let them off the loop, And so it's like, and when you do follow-up, you can't be like, it's fine. It's like, I don't like bust their balls, so to speak, but it's like, I'm going to be like, oh man, like this is important. Like this is a crucial part and important to me. Yeah. And it's important for you to feel better. And so once you follow up, they're like, oh shoot, like he meant business. Like I got to do this. And I reemphasize, like, you need to do this because this is a crucial part of your plan,
And there's this motivational interviewing portion part, right?
Exactly.
That happens along the way because you're essentially figuring out where people are, whether they're just like in the pre-contemplation phase where there's like, this might be a good idea, but I'm not ready. Say just like something simple as quitting smoking, right? It's like, yeah, because if a provider comes and they say, this is what you just need to quit smoking, right? But they're like, yeah, I like it too much. And I'm like, I've thought about it because I know that it might create lung issues later, but they're in the pre-contemplation phase. They're not even contemplating it yet. Then like, how is this going to create a barrier, right? But I think the piece I wanted to add to that, back to the care portion, if they know that you care, like you literally care about them as a human, they're much more likely to do it.
Yeah.
Right? They're more likely to listen, right? When you know their family, it's like, hey, I know you're not like fully on board with this yet. You're kind of in that, might not say this, but pre-contemplation phase. You're just thinking about it. But I know Betty really wants this for you, your wife. And I know that your kids really want a dad there for their whole lives. And they want you to be there for their grandkids. And is that meaningful to you? Is that as important to you as it is for them? Right? And you can move them from pre-contemplation to maybe contemplation, right? And you're moving them down, we call it this motivational interviewing, right? You figure out where they are, the interview process, and then you're moving them from one phase to the next.
Yeah.
Some people call it manipulation. I don't think it's that at all.
You're guiding them.
Yeah, you're guiding them through that process, and you're guiding them to the change that they ultimately want in the end.
Yeah.
But you're figuring out where they are consciously, unconsciously, and helping them along that journey to good change, right? Tell me your thoughts on motivational energy and how you use it in the clinic.
No, I love it. And that's why it's like when you have those pre-contemplative patients, they're tough, man. They're so tough. because they're like, I'm fine. And so those are the ones that are, I feel like, sometimes more comfortable just being that passive bystander, passive consumer of just give me the pills, inject me. I'm not going to change.
I've had a bad back my whole life.
Yeah, this is the way it's always going to be. My dad had a bad back. My mom had a bad back. I have a bad back. And it's just like they've kind of given up. And I'm like, I just think listening, because maybe it just stems from like some degree of hopelessness or some other issue that, or misunderstanding that, oh, like the example I just gave, like my parents and my brothers and sisters have all had bad back, so I'm destined to have bad back and there's nothing I'm going to do. But then if you educate them, be like, you know what, man, like it doesn't have to be like that,
Yeah.
then it can infuse some hope, and then maybe they can get to that contemplative stage. But I think going back to your original question, things that we can do to help them, to become more active participant is just listening and making sure they know that you really care.
Yeah. As a provider.
Because if they think you're just coming in, clocking out and just going through the motions, then they're going to a lot of times just send out what they're getting from you, But if they're like, man, like Brad's really bummed when I show up and I haven't done like anything he asked me to, then it's like, and you're listening to like what's going on in their life, like, like family tragedies, and if you're like, instead of haranguing them about like, why didn't you read about sleep hygiene? You're like, man, like what happened? Like, how did that affect you? And then they're like, man, this guy cares about me and he's trying to help me.
Yeah.
And he listens. Like they're going to sometimes just go to bat for themselves, but also for you. And so the buy-in is better.
Yeah, absolutely. I love that.
There's so many layers.
Meaningful difference when they know you care about them.
Mm-hmm.
And the thing is, I'm trying to get one of my friends to present at rounds, or Amelia Thorne. Mm-hmm. She was a Disney princess. And she got some really intensive, Disney princess for Disneyland. Mm-hmm. But they get really intensive training on how to deeply connect with people quickly. You think about the volume of people that they have in line, but they have to connect with this little child and make it special. Right?
Within seconds.
And if you've met Amelia, you know what I'm talking about. This girl will make you feel that you are the most incredible person in the room and the most important in the room in literally 3 seconds.
Wow.
Because the way that she engages with you and how special she makes that interaction, mm-hmm. right? And she can go around the room really quickly and do that with a ton of different providers. And I've always respected that about her. And then I learned she got the training from the Disney princess training. And part of it is she can't share some of it, but I'm trying to get her to do a presentation. I think we nailed it. I think she's scheduled, so don't miss that one.
Okay.
But just really, like, it's just the looking in someone's eye, right? And being fully present and fully connecting with them and figuring out what matters most to them, mm-hmm. right? And sometimes you only have 20 minutes, but you can deeply connect with every patient. And the same thing on the patient end. You can deeply connect with your provider mm-hmm. quickly, mm-hmm. right? And if it doesn't happen and you don't feel like it's vibing with you, it's okay. Switch, find a new one, And that's what we're all about is finding providers that you really connect with and that are going to help you and that care about you. And that's really important, mm-hmm. Tell me, how can patients be the best advocates for themselves? We're thinking about this journey, and we're thinking about outsourcing our bodies to other people. Like, how can they truly be the best advocate for themselves?
I just think that just realize that this is your health and you have a right and a responsibility to know what's going on with your body, and not just to have all these PTs and docs and other healthcare professionals poke and prod and give you stuff and cut you or stick needles in you. It's like you have the right and responsibility to know what's going on with your body. to know these disease processes, to know why we're doing this and why we're taking that and why Brad is trying this different maneuver, because once I almost became a teacher instead of like doctor. And so I love teaching, and like just know that as a patient, you have a right and a responsibility to it. Like from any of your healthcare professionals, like ask questions, be curious, because the more you understand and know about whatever ails you, like the more excited you're going to be, the more accountable you're going to be for your health, the greater buy-in you're going to have to the plan, because now you're an active participant instead of just being like, well, I don't know what's going on, but the doc told me to do this, so here we are.
Yeah. I've done a lot of podcasts, Jared, and that is probably the most profound thing that's ever been said in the studio. Like what you just said, you have the right and the responsibility to understand your own body. This is your vehicle.
Mm-hmm.
This is your customized personal body. And you have both the right and the responsibility to own that.
Mm-hmm.
We should not be outsourcing our health to anyone else. We should be using them as consultants.
Yes.
Right? Someone told me early on in business, do not ever outsource the branding of your own company to anyone. Right? And I keep that very tight because this is my brand.
Yes.
Right? Yes, I have a marketing director. Yes, I have these people that I use to consult with to figure out the best way to tell our story. But ultimately, no one will tell my story better than me. And I will never outsource my brand to anyone else because it's me.
Mm-hmm.
It's my company.
Yeah.
And the same thing is with our bodies, right? Yeah. Like, don't outsource your health to anyone else. That is both your right and responsibility. Just like my right and responsibility as the CEO of my company, I cannot outsource that because it is me. And same thing with your body. Your body is you, and you have that right.
Yes.
And that huge responsibility to understand it, to be educated on it. You don't have to go to med school. Right? But there's so much information out there, and sometimes filtering that is the hardest part.
Yeah, for sure.
And that's our job.
Yeah.
Is to help you filter that,
Knowledge is power. It's cliche, but it's true, and like the more you understand about whatever ails you, you're going to feel that power as a patient, and it's going to excite you. You're going to be more excited about putting together a plan that gets you to the goals you want to achieve.
Yeah. Let's wrap up with this last piece. If someone's stuck in this outsourcing that we've been talking about on this podcast, where they've just become a passive participant, what advice would you have for them?
Man, that's a great question. Could you maybe like describe a scenario? So I can
absolutely.
Think about it.
So, we have patients every day that come into our clinics that have become dependent, that maybe they don't know how to get stuck out of the management of it. And they are just frustrated. They feel like they're just in this hamster wheel of just constantly managing their condition. And they just feel like they can't ever really just take ownership or accountability over their health. What advice would you have for them?
I mean, I know where I would start as a physician is just why are they there?
Yeah.
It goes back to the whole listening, like, and trying to figure out why they've relegated themselves to this position, because sometimes it's just, if I start giving them information, they're going to be like, ooh, their ears are going to perk up. Like, you're actually telling me like why I have rotator cuff tendinopathy and like how I got here and all the things we're going to do to fix it. Like, this is awesome, instead of just having like, oh, my shoulder hurt and I went to PT and it got better. I don't know what's going on, but they said it was something with my rotator cuff. Like, they're going to know why their rotator cuff is doing the things they're doing and why these exercises are so important. And so there's some that just like, if you give it to them, they're going to get excited. But sometimes the ones that are just, I'm thinking of a certain type of patient demographic where they're just like, is this like this, and that's how it's always going to be, is just asking them, like, why they're like that, because it's probably just a combination of the old culture of medicine or poor understanding or misinformation. And once you kind of like understand where they're coming from, then you can know how to address and how to bring them out of it, but I just feel like a lot of people just be curious, ask questions. Like, I mean, the human body and medicine and healthcare is so cool. Like, science is so cool. Like, there's a reason why I went into medicine. I loved science from an early age, and like the kind of things that your body can do is just absolutely miraculous. And so, like, the more you start to learn about it, I think the more excited you'll be, But for those ones that are just kind of, they've relegated themselves like, this is how it is, that's how it's always going to be, just tell me what to do. You got to listen, and you got to figure out why they're the way they are.
Yeah.
And then work from there, and then go into like actually treating their actual, what they came in for, whether it's like knee pain or shoulder pain or something.
Yeah. I love that. And one thing I hope that they hear is you don't have to be stuck.
Mm-hmm.
Like, there is a pathway. Your body has a natural internal hard drive of healing. And sometimes it needs some tools to remember that. But our bodies adapt. They adapt based on demands that we place upon them, the tools that we give them, the nutrients that we give them, the sleep that we give them, right? They naturally repair themselves over and over again. And sometimes they can get stuck in this repair cycle. And our job is to help facilitate that repair cycle again. But ultimately, I love your story and this journey that you help people with, because essentially is what you're telling them is you don't have to be stuck.
Mm-hmm.
You don't have to stay here. And you listen to their story, you figure out where they are, whether they are in the pre-contemplation phase or the ultimate change phase. You're helping them through that journey of those phases, and it becomes challenging. There's a lot to unpack. There's a lot to facilitate. And, this is one piece that I really would put out there is make sure try to stay with one provider in each realm of your life. Mm-hmm. Because once you know them and they know you, man, it's incredible, right? When you have those people in the healthcare system that have helped you, try to stay with them, mm-hmm. because they can help you through a lifetime of events and journeys, and they get to know you really well and your goals and your passions, and it can help. And don't keep in mind, it's good to get some shifts every once in a while, find a new provider. But for the most part, you find your circle of people, stick with them, because they're going to help you through a lot.
Yeah, I couldn't agree more.
Is there any last thoughts or advice or tips that you'd give for education, empowerment, and accountability to truly being responsible and owning the right to, mastering your own body?
I mean, to the providers out there, I'm like, you got to educate. If you want your patients to be more compliant, if you want them to follow your plans, like, I've been alarmed at how that can change if patients just actually know what's going on, and just taking the time to explain what's going on in their body and why you want them to do what you want them to do. Like, that is powerful. It's so powerful. Like, the lights go on, patients get excited. They're like, okay, yeah, let's do it. And for patients, I would just say, like, be curious. Like I said, it's a right and a responsibility to kind of know what's going on in your body. Like, what are these medications? What are these injections? What are the long-term benefits of these, And so just be curious and know that you're entitled to that information. And if, like, your provider doesn't do that, then ask them. And if they're like, then maybe, like, go somewhere else,
Yeah.
There's a lot of good healthcare professionals out there. And I just feel like healthcare in the United States would be better if just there was more patient education and patient curiosity between patients and providers.
I love that.
So,
well, thank you for sharing your expertise.
Yeah, my pleasure.
Dr. Aida, it is an absolute pleasure to be in this community with you and to just have this conversation today. This has been very impactful for me, and I hope if you're listening to this podcast, you can take these tips and find providers that really care about you, find providers that educate you well, and most importantly, take on the right and the responsibility over your own body and your own health care, because it's so meaningful when you do. So thank you for joining us today.
It's great to be here. Thanks for having me.